Welcome to Rounded Momma's YouTube channel. We thought today we would do something a little different since we all live in Nevada. We're all home birth midwives in Nevada. We thought we would talk a little bit about some regulation that's getting ready to pass. So my name is Sherry. I have Cora, Tori, Sarah, and Tiffany, and we all own a company called Rounded Momma, and this is our YouTube channel. However, we do work with a lot of other individuals. There's another organization in the state called the Nevada Association of Professional Midwives, and a couple of us are on that board. I'm the president of that board, and then there are other members. I have this amazing co-president that is up in Reno. For those of you who don't know, Nevada has got two totally separate populations. You have your Las Vegas area population, and then you have your Reno, Nevada population. The reason why that's so important to bring up is because it has affected the different climates. So each climate is fighting for certain things to be in law or kept out of law. So let me start by saying there are a lot of midwives in the state of Nevada. We currently do not have any regulation outside of, there's a couple things in the statutes like offering erythromycin to clients. We can't lie about birth certificates. You know, there's a couple things, but for the most part, because midwifery was deemed by a court system that it was not the practice of medicine. And we've always loved that freedom because it's all about the families we serve getting to choose where and with whom they want to give birth with. Nevada has been a little bit behind when it comes to things like we don't have birth centers. If you go to the hospital to have your baby, a couple of the hospitals are letting you now walk around and be monitored, and nobody's letting you do hydrotherapy right now. They're rarely letting you eat in labor. Like, we really are a little behind what the rest of the world is doing when it comes to including the individuals who are laboring into their choices for care. We do have a decent amount of individuals that seek home birth. Average in America, about 2% of the population seek to have their babies in a home birth setting. And that is who we, as direct entry midwives, that's what we work for. Sarah, would you mind describing what the two different types of midwives that you could be?
So everyone practices what's considered the art of midwifery. So anyone who calls themselves a midwife is practicing midwifery. However, there are add-ons to that. Anybody who is not a nurse midwife, so if you're a certified nurse midwife, that means you went through the nursing pathway and that you have that nursing additional credential. However, any non-nurse midwife is considered a direct entry midwife. So any traditional midwives, CPMs, anything like that, that they practice the art of midwifery that did not take a nurse path is considered a direct entry midwife.
There seems to be a lot of confusion about that. Sometimes you get labeled midwife, traditional midwife, certified professional midwife, but we are all direct entry midwives. All of us, regardless of how we came to this point. Whether we trained under someone else, we went to a school, we all are direct entry because we don't enter this field as nurses. For the majority of us, that's because we didn't want to, because we believe birth to be a normal physiological thing that happens to individuals. And if you look at the World Health Organization, only about 15% of the time do individuals need some type of intervention. And I would say when you look at the numbers here in Nevada, that's pretty accurate. So that's kind of the second myth that I think I want to dispel. And when midwives are practicing, there is this idea that what we're doing is a hospital delivery out of the hospital, and that is not what we are doing. We are doing a home birth, which means we have been trained to look for things that could put somebody at a higher risk or makes them not a good candidate for staying home, or do we need this additional thing? That's what our training consists of. We specialize in normal. Now, as in any state, you have midwives that believe different things. They have different philosophies, different understandings. I think you would find that amongst physicians and nurses. Although they answer to the same organizations, they have their own different unique philosophies. Which, thank goodness, right? That's why there are individuals that you can go, if you don't like that physician and their philosophy, you can go to another physician and their philosophy. So there is an assembly bill and there is a Senate bill. We were kind of informed, the certified professional midwives had gotten a little bit of a heads up that there were a bunch of things that are hitting. And there are. If you're following Nevada legislation right now, there's doula stuff, birth center stuff, all kinds of midwifery stuff. So we are so grateful to the lobbyists that gave us a heads up that there was stuff coming down the pike. If something came up, what were
Our
things
bill would
we
look like.
wanted to fight for. We started then going through the steps and processes. We hired a lobbyist to walk us through, because we are midwives first.
Not
Not
Senate
lobbyists.
people.
Not politicians.
Not a politician.
We've had a few lobbyists actually that have helped us. We have some senators that have been super helpful. We've just really received a lot of support. Well, what had happened when we started this open dialogue, there were 2 other midwives that were a part of a lot of those other bill meetings. And they just were super opinionated about what they felt like the law should look like. Which, you get a bunch of midwives together, you are going to get a bunch of individuals who don't
Different opinions.
agree. I've always said that when it comes to solutions, that the answer lies in the disagreement, that the truth lies in the middle. And so you've just got to be willing to hash out differences amongst each other. But what these 2 individuals did is they just decided to go work with someone else. Normally we wouldn't have a problem with that, but there's a lot of things in the bill that we don't agree with. Ida Dara is one of the individuals who help run the North American Registry of Midwives. The North American Registry of Midwives is who we certify through. She's been at every meeting we've asked her to be at. She has been amazing. And so we have followed her counsel on what other states are doing, what's working, what's not working, what we should fight for. Because what happened is then all the CPMs in the state formed an organization called the Nevada Association of Professional Midwives, and we started talking. The problem is they just kept talking about these hills to die on. You can't really have a hill to die on when you're working with a collective of 30 or more people.
Well, and when you're working for the people, like we're working for moms and
We
families.
care about what families say.
That's
So-
a big, important thing.
Absolutely. I agree with you 100%. And we have been in communication with the non-credentialed midwives. The non-credentialed midwives, they don't want any legislation. We don't blame them. We support them in that endeavor and that fight. But we're at least having conversations with them and listening. So when they get to us verbiage that they would like to see in the bill, we want to fight for that verbiage. It's really important to us that our language and our bill is a good bill. The last thing that we would ever want is a bad bill.
Right.
That a bad bill is worse than no bill, a bad bill is worse than
Any other option.
any other option. So we've worked with our bill with the other certified professional midwives in the state, and there are lots of other midwives up in Reno that we have been in communication with, as well as the non-credentialed midwives, right? So the non-CPM. Because we support the North American Registry of Midwives, what we felt like there was no reason to put a lot of things into law that we have already agreed to do. Midwives are all about
It's
not
already-
making more work for ourselves than
it's
we
already
want.
in our regulations.
Right. Midwifery used to be about caring for your community. Midwives have been around since the beginning of time. There would be an individual that would
The end.
know herbal remedies and positions, manage childbirth. That was the gig. That continues to be the gig. That is what we do. And so in order to pass that on, what we complete is this PEP process, and it is an apprenticeship. So Tiffany and I are the only preceptors down here where we sign off on students. Their frustration is they want in their bill for it to say preceptors have direct supervision and have to be on premises and blah, blah, blah. Did you already sign a piece of paper that says that you do that?
Yes.
And who'd you do that with?
NARM.
Okay. Why do we do that with the state?
We don't need to do it with the state. NARM sets our regulations and what we have to do. So we have to follow what they set for us to do, and we're already doing that. We don't need to reinvent the wheel.
Yeah.
It's already there.
And if
It's
you
there.
think that someone isn't doing that, that's what NARM is for.
Then
Right.
report like
Right.
Report it to NARM.
Right.
You can lose your credential when
As a
NARM
preceptor.
ever does like an investigation and calls a peer review. If you do something that you have not agreed to do, you could lose your preceptorship.
And
you
your
could lose your
CPM.
certification. NARM has already said that, but you know what? If I make a mistake, I would rather lose my certification than go to jail. We have no problem directly supervising our students.
Well, and we're saying we're following the North American Registry of Midwives guidelines.
Yeah.
Yes.
Correct.
We're agreeing to that, so it's already there. We don't need to re-put it somewhere else.
So Tori, what else does NARM require us to do when it comes to cultural competency?
So they already require us you can submit it in phase 2 or in phase 3, but it's already a requirement that we submit our cultural competency or cultural humility class It's already required before we're even able to sit for our CPM exam. We need to show proof that we've completed that course. And they have a handful of courses that they've approved, so you do have a few choices in which class you take, but they are all regarding the same cultural topics and how to address those situations, how to be appropriate, how to be good care providers for those families who might have different cultures than us or different life experiences than us. That's already there. Again, why reinvent the wheel when NARM already says it's a requirement of us?
They, over the years, have recommended lots of different cultural competency.
Yeah. So who has taken more cultural competency classes than one? We are all about getting the best information that we possibly can to give our clients the
And
best
we
care.
constantly continue education as well. It's not like
Right.
it's one-stop shop. So
It's a requirement.
it is a requirement to keep up on these things.
So it's there. So we're doing it. We're
Well,
not
and
opposed to it. We just don't want it in the law. Cora, how old were you when you first came to a birth with your mother?
I was 14.
So their bill requires a specific training for midwifery assistants. Some of the biggest problems with that is A, the state doesn't require me to take an assistant.
Right.
I can go to a birth by myself as a midwife. I don't have to take anyone. However, this bill requires if somebody did want to be an assistant that they would have to go to school. There are maybe 4 midwifery assistant schools in the United
Is
States.
there 4?
I thought it was 4.
I think there might be.
But we're talking about the whole country.
Yeah,
We're
we're
not
talking
talking about
maybe a
Nevada.
handful.
Now, what about individuals who are interested in birth? They went to a birth of a friend or a loved one and they felt called to the birth, and then they want to start coming to birth to see if it's a field for them. How many people go to college and change their majors? And so all the students I take on, whether they continue their studentship or that became just a life experience for them, I think is amazing. When it comes to assistant training, all of us take individuals to births who have that ability to train. But we don't need the state to tell us what that skill set looks like. We already have the skill set and possess the skill set. Cora, when she was 14, went to a client of mine. I delivered several of her babies. And that became a huge part of Cora's desire to go into midwifery. You pass on that tradition and you make it accessible, especially in parts of our community and our culture where they practice differently, whether that be an Orthodox Jew culture or individuals of color or an Indian reservation.
Yeah, and I think that really just takes away from those people who maybe have a traditional midwife there that takes care of them, and now they're not allowed to take people with them. It's just a weird
Well,
concept.
and-
they're not practicing any skills. They're
Right.
just in attendance.
Well,
so.
and midwifery, through the history, like the grandmother midwives, they took other people with them to train them and to show them, pass that knowledge on. And we don't want to lose that.
It would completely prevent anybody who wanted to take care of their own indigenous community from apprenticing with a CPM.
Right.
Well, and I think it's important of note too that any midwife understands the skills of their assistant. If I brought Cora when she was 14, I would not be handing her a syringe. You understand the skills of the people that you bring with you.
Again, we're not required to take an assistant. Now, while we do practice that way, it shouldn't be in the law.
No, and we are taking full responsibility during
Correct.
that delivery.
Right.
Now, there is some question about how their bill reads when it comes to the boards and the task force. So we are kind of working through some of that information. So I certainly don't want to share information about that, but as midwives, we would really like our board to consist mostly of midwives. Because when you have a board of physicians or a board of nurse midwives or a board of nurses, like
Or a board of dentists, or a board of chiropractors, or a
you
board of
probably
anyone
have
else.
mostly individuals that
know?
are that board. And so we're okay with a couple of physicians sitting on our board, but we want more midwives' voices to be heard, especially when it's coming up with our regulations and our statutes, because
Yeah.
the midwives are the ones who understand home birth. Why is this PEP process that we're fighting for so important? There are currently 2 pathways to get your certified professional midwife.
Through the same
credentialing.
certifying body.
Through the same
Yes.
certifying body.
Same certificate.
Same certificate,
Same
same
piece of
test.
paper.
Yep.
Same test.
You can go to what is called a MEEC accredited school. MEEC stands for Midwifery Education Association Council.
Accreditation.
Yeah.
Accreditation
Sorry. Yeah.
Council.
Sarah's in
Yes.
charge of the acronyms.
And so that is the school. There are colleges that are set up that train midwives to do that.
There's
And
currently not one in Nevada.
there's currently not one in
The
Nevada.
closest one is what, Utah?
Yeah.
I think the most cost-effective one is about $10,000. And what's crazy about that is you still have to complete an apprenticeship.
Yep.
So you're going to a college, you still have to complete a 2-year apprenticeship, and then you sit for the same exam that the rest of us did. So there are not very many individuals who
Handful.
get that. So then there's the PEP process. Those of us who went the PEP process, we just didn't attend a MEEK accredited school, but what we did do is we completed an apprenticeship, and then it was self-study. So we could choose where we were gathering our information from. Through books, videos, attending courses. Every school has kind of their own little niche that they're good at. You have Bastyr, you have Utah College of Midwifery, you have, what's the one in New
Frontier.
Mexico? That's the least expensive one. Oh my gosh, I don't know why it's leaving. But there, a lot of their courses are free. Like they have access to a ton of their courses from that college are free. So like if you couldn't afford to go to their college, they have tons of education that you can download and process on your own.
Well, and NARM gives us the CIB, which gives us a syllabus, if you will, of everything that we need to learn, study in order to be successful in our exam, which is what the colleges are using as well to administer
In
that
order
education.
to pass the exam. We all have to pass an exam.
And it's the same exam.
Same
So
exam.
regardless of what pathway you chose, you're sitting for the same exam. Now what happened was a bunch of individuals got together. It's called the US MERA. I'm not even going to tell you what US MERA stands for. We're just going to call it US MERA. A bunch of individuals got together and started discussing what could the NARM, the North American Registry of Midwives, what could they do so that the American College of Nurse Midwifery, as well as the American College of Obstetrics and Gynecology, what could we do so that you might be more accepting of our knowledge and our education so that we might be able to work together to give the best outcomes? And what US MERA came up with was this thing called the bridge. So they were like, what do we do with people who are currently practicing? We can't send every CPM back to school. And so what they did is they created the bridge certificate. Now the bridge certificate requires that we get certain credentialing through them, an additional 50 hours of continuing education
52,
credits.
isn't it?
50
Yeah.
CEUs in 3 different categories.
Yeah.
Correct. Those trainings is not only MEEK, but we also can do ACOG, ACNM, AWHONN, which is a nursing accreditation, the AAFP, which is the Family Doctor Association, any state health and nursing and perinatal programs that have to be approved by our governing body that say these are approved classes. There was also something created called the ICNM, which is the
International.
Confederation
Of
of
Midwives.
midwives, and they came up with a bunch of standards as well for what the expectation of midwifery. And we'll link all of that below. ICM is a really good place to look. You can certainly go read the US MERA. But the problem is nobody could totally agree. So US MERA still sitting there, but it didn't make anything null and void because they couldn't further their conversation. So the North American Registry of Midwife continues to offer both of those pathways. It's not like when it expired, it meant that the bridge and the PEP process went away. It's
Still
totally
available.
still available through the North American Registry of Midwives. And so we do feel like fighting for the PEP is a really important thing. So when you look at the overall language of both the bills, I really think some of the biggest differences is you have your assembly bill, which I feel like the language behind that is how do we make physicians and nurses respect us more, and how do we practice more the way that they would like us to practice? Whereas I think the Senate bill is more about what do the people need? What do the midwives in our state need? So that we might be able to practice to the full extent of our scope of practice and be considered for transports. What every state has done when it comes to talking about what makes home birth a viable option is that we have physicians and nurses and hospitals and doctors so that for that small percentage of time when we have a complication, just as a hospital has the complications, just like you have your operating room up the hall, you guys are what we need when somebody risks out of having a home birth. The problem with not having regulation is you potentially, I say potentially because down here in Las Vegas, we have amazing relationships with hospitals, doctors. We don't have the problems they have up in Reno. We already have that great relationship, but we can see that without us being regulated, doctors, hospitals, nurses might be worried or concerned that they're taking on a liability that they feel like shouldn't be theirs to take on. And so we're okay with that. We're okay with assuming a certain amount of liability for our profession. That is why we are fighting for our profession to be recognized. And we understand some regulation has to come with that. However, It's more about recognizing we exist, differentiating what types of midwives are, since that is so confusing to individuals, so that clients know who they're hiring, and how we can kind of better those relationships with hospitals and doctors, that we might be able to give really great care to our clients.
I think some of the points I wanted to make about how great the PEP process is that it does allow people who don't normally get that chance to become midwives a chance to be able to get that education. I know for me, I have smaller children when I started my apprenticeship, and so it really did allow me to work around my schedule. Like, I could take classes and work when I need to.
It's because there is something about our lifestyle that we are on call. So when you are in an apprenticeship, it is a brutal 2 years. Generally, like, our students are on call for both Tiffany and myself. You're working really hard to get that education. And so childcare, if childcare is a problem, it's nice to work within your community so that we can help support each other, and that individuals don't feel alone as they're going through their apprenticeship.
I think the biggest thing that I think should be reiterated and driven home is whether you choose to go through a MEEC accredited school or through the PEP process, the end result is the same. You have to take the same test, you have to do the same things to get this certification. So eliminating one of those pathways that's actually more accessible, it would be a disservice to the communities that we live in.
I think the most poignant question I've gotten is, what if our bill doesn't pass, or the assembly passes, or what happens? Honestly, we love our bill. We love the Senate bill. However, I would rather have no bill pass than the assembly bill. That is how strongly I feel about the language that's used in the assembly bill. It is not for the people, and it is not for the midwives in this state. So for us, if you support this bill, if you want to keep access open to individuals that are seeking midwifery care, as well as those who are interested in becoming midwives, then the Senate bill, go read it. We've got a couple big changes that have to happen after it went through the writer, and hopefully those are done soon. Once those things are changed and it adopts those couple things that we needed, it is a good bill. We work really hard to have a good bill pass. The second thing on the list would be no bill, because what we're doing right now in this state is working for us. So we appreciate you watching. We appreciate your support. If you have further questions, just ask them down below. We'll be monitoring this thread so we can answer questions, because we get why it's so confusing. It's confusing to us, and this is our field. Thanks for joining us, and we look forward to seeing you later next week with the more informative bill. It stands for Portfolio Evaluation Portfolio, right? No.
Professional
Evaluation Portfolio.
Yeah.
Yeah. No, it stands for Portfolio Evaluation Portfolio.
It's an apprenticeship.
Portfolio evaluation process.
Midwifery
I've been staring at these
Education
damn acronyms for
Accreditation
so long.
Council.
Oh my gosh! We get why this is confusing.